One of the most common questions I get asked as a physical therapist from patients who recently had hip replacement surgery is, do they need to use a walker in that first 1 week after surgery if they feel like they're strong enough and that they don't have more pain when they try to walk without it? So, short answer is yes, you definitely need to use a walker and assisted device that first 1 week after this type of procedure. We'll get into exactly why you want to use it, how it can reduce your fall risk. It allows adequate tissue healing so you don't increase any inflammation and symptoms. But I'm going to share two stories of patients who decided to go the route of ignoring my suggestion and my recommendation as a physical therapist. So, with these hip replacements, both patients were similar in age. They were both the same gender, and they also had relatively similar physical activity levels. They were both active. They went to the gym multiple times a week, and they they had very similar living situations. So both lived on two-story homes. Both had relatively sedentary jobs, but in that first 1 week, as I advise all of my patients who had hip replacement surgery, is you definitely need to use your walker in that first 7 days after the procedure. Now, for both of them, because patients are going to do what they choose to do when they're in their home and when the therapist is not with them. So there's nothing we can do about that as a clinician. We give our recommendation and our instructions of what will help them in terms of their healing and their recovery, and it's up to them if they want to choose to use that. Now, with these two patients who presented very similarly, had very similar backgrounds and symptoms overall, they both decided to use no walker while they were walking around in their home, and they both had very different outcomes and very different essentially responses to not using that walker that first 1 week. So what happened was one patient decided to ditch their walker, and they ended up doing surprisingly well. They were very strong. They were actually able to perform a leg lift within the first few days, and that wasn't even recommended to perform the movement as high or the manner that they were performing it. They were within their precautions of what they were allowed to do, but they just exceeded the expectations that I had in terms of their strength, their stability, and more importantly, their reactive pain, their reactive symptoms. Whenever a patient is working on different physical movements, whether they're doing their exercise, whether they're walking, they didn't have any increase in pain or swelling with walking without the cane or walker, and with doing these exercises. They responded very well. They healed very quickly with essentially no pain medications. They weren't on any the opioids that they were prescribed. They were only using very minimal amount of Tylenol, and they were able to wean off of that within days. Their pain tolerance, their overall recovery was just great. Now with the other patient, after trying to do no walker, no assisted device with their walking in their home, after the first few days of them trying to do that, they had increased pain, definitely increased swelling, and they started to walk more with a more increased limp. They weren't walking with a limp when they were using the walker, and initially when they tried to walk without a walker, but after a few days of trying that, they had a more pronounced limp, as well as the increase in pain and swelling. And because they had more inflammation and more discomfort at the hip and at the thigh, now they were more limited in their overall function. So getting in and out the bed, in and out the chair, and they weren't able to perform their home exercise program as frequently as was suggested, because when they would try to do some of the exercises, it would hurt too much because of the amount of walking they did without their assisted device. So that's two different patients who had very similar backgrounds in terms of their overall physical health, physical strength, and their routines. And they both decided to go against my recommendation of using their walker. One responded very well and was able to manage and successfully progress their exercise, their walking week by week, and the other had a setback and had to decrease the amount of exercises, decrease the amount of walking, and focus more on a lot of symptom and pain management. But they appear to be very similar. So you can never tell what patient, like who exactly is going to recover faster or slower than another, especially if you're having similar patients who present essentially the same. Everyone's body is just going to respond differently to this type of surgery and to exercise and to walking. So, to be on the safe side, because what we do know is with a walker, when you're performing your gait training, so when you're practicing your walking at home, you're definitely able to offload that hip joint and that surgical leg, that surgical hip a lot with that walker, and that can allow you to, one, focus on the appropriate mechanics that we need to get back to, because you have to retrain your body how to move how it used to move without any antalgic gait or limping gait pattern, so that painful gait pattern. We got to make sure you're able to perform the proper walking mechanics accurately and without increasing the inflammation and pain. So that walker, that assisted device allows us to do just that. It allows us to practice the mechanics without the full weight bearing. So another example of this is when people use underwater treadmills, when they use altered G treadmills, so those anti-gravity treadmills, they often use those after certain procedures or certain injuries to allow them to practice the running, the walking mechanics with less weight bearing. So they'll do that in the water. They'll do that with the anti-gravity type of treadmills. Now with the reason why you don't want to do like a under aquatic therapy in that first week is because you're still waiting for the incision, all that the tissue to heal, to make sure everything is closed and that it's a safe time for you to submerge a wound or incision to that much water. So that's why the aquatic therapy isn't initiated right after surgery. You have to allow the incision to heal and to close. But the walker and assisted device is a great tool that we have to allow us to take some of that weight bearing off of the hip. So for example, even though that patient who went against my recommendation and didn't use the walker for their walking practice in their home, they still were able to have a good outcome and tolerate the walking with no reactive swelling or pain. But maybe they would have been even a little bit further or had even less pain if they had used their walker that first week as I recommended. But in general, to be safe, we know that you can take a lot of pressure off of that hip by using the walker. So that's why we want to make sure that a lot of our patients are using that walker in that first week. On top of anyone who was a fall risk before surgery, that walker allows us to keep that risk of falling to a very minimal level so that you can just focus on the proper healing, the proper exercise, and the proper retraining of your overall movements in a safe way. So ditching the walker too soon, especially in that first week, can be more detrimental than helpful, even if you feel like it's it's a barrier. It gets in the way. It's clunky, especially if you have like tight quarters in the home and there's a lot of furniture that make it difficult for you to manage. That's why we really want to, as we can, make some space prior to the surgery so that you're able to have your typical walkways manageable with your assisted device, so that way you can safely use it and effectively use it in the home. So those are two instances that people went against the typical recommendation of using that walker in that first week. Two different outcomes, but overall, it's still recommended that you do use that walker for that first week to avoid the instances of that one patient who ended up having a less ideal outcome and had more pain and swelling. And we also want to reduce the fall risk. So if you're ever in question, use the walker more often than not versus the other way around. If you feel like you don't need the walker, it's better to be safe than sorry.